much indeed. Thank you. Now, excessive drinking by young teenagers and children is storing up a time bomb of health problems, including liver cirrhosis and cancer. And that's according to the British Liver Trust. Latest figures show the number of people in their 20s dying from alcohol-related liver disease is the highest on record. Keith Doyle reports.
Most of my friends are 17, 18, and they drink like a lot.
Tell me what you drink.
Lamborghini sometimes, or vodka and Coke.
And you're 13?
Yeah.
So you're not worried about drinking at such a young age?
No, not really, because I don't drink a lot.
Somehow it doesn't seem shocking talking to 13-year-olds about how much alcohol they drink. Young people are drinking more often and are drinking greater amounts. The knock-on effect is more young people are dying from alcohol-related liver failure, a condition brought on by the long-term abuse of alcohol. The latest figures show 144 people between the ages of 20 and 34 died in 2006. 49 of them were in their 20s, the highest on record.
We're very worried about the number of children that are drinking, and although that's declined a little bit, the amount they're drinking has gone up. So the burden on their developing bodies is going to be even greater. It means we're storing up a ticking time bomb for the future, where as they grow up in their 20s and 30s, they could be putting themselves at risk of really serious liver disease and indeed liver cancer.
Louise Rhymes' daughter Stacey died earlier this year of liver disease, brought on by the long-term abuse of alcohol. She was just 24.
By the time she was 18, she was drinking every night. Probably 5 litres more if she could get hold of it. She'd drink until she'd got none left. By the time she was 23, she was deteriorated badly. She was covered in bruises. Her hair was falling out. The week that she passed away, she got liver disease, kidney failure, a hole in her stomach where the alcohol had rotted her stomach. They told us there was no more that they could do.
In 12 months, there's been a 50% increase in young men with alcohol-related liver disease seeking help. At this youth centre in East London, they're trying to reverse that trend.
When you do wake up with a hangover, it's a blooming headache.
Discussion around young people and alcohol usually centres around the damage that they do to people, property and society. But here they're talking about the damage that it can do to themselves.
You're going to start over there. You're going to look up, left hand, spin around the other way 10 times.
Exercises like this have instilled a responsible approach to alcohol in these teenagers, but that's far from typical.
Nearly every day, they're bunking school, bunking college, anything. Yeah, it is just they're binge drinking nearly every day, which is really surprising.
Doctors say the results of that are now being seen.
People as young as their early 20s are coming in with jaundice, with their abdomen swollen because the liver is failing. This is a new thing. When I became a liver specialist 25 years ago, cirrhosis of the liver was a disease of middle-aged and elderly men. Now we're seeing it in men and women as young as their 20s.
Stacey wanted to warn the kids of the dangers. She was a big part of our life, loved by everybody, and she's gone.
Keith Doyle, BBC News.
Now, you saw Imogen Shillito in that report. She's Director of Education at the British Liver Trust, and she joins me from central London. There are loads and loads of reports, Imogen, every week almost about younger people drinking and what should be done for them. So what is going wrong?
Well, I think these government statistics that are out show really tragically the evidence of all this drinking that is having on children's health. They're storing up problems for their future health, not just when they become older in late middle age, but in their 20s and 30s. So I think what we need to see is a package of measures that are really effective in helping children avoid the health harm from alcohol and indeed in treating liver disease as a whole.
And what would you recommend as those measures?
Well, we'd like to see a national strategy on liver disease that looks at the whole range of things, including prevention. Prevention is very important for a number of factors, including alcohol and also obesity and viral hepatitis that can cause liver disease. We also need to do more about early diagnosis because the harm that is done to livers from alcohol, it takes many years to develop, sometimes up to 15, 20 years. So if you can identify the people that are potentially damaging their livers and and offer them help and treatment at an early stage, you can potentially avoid these really serious effects of alcohol on the liver, including deaths from liver cirrhosis and indeed liver cancer.
Do you think a lot of it is due to the fact that young people don't see that they're actually consciously killing themselves? They just see themselves as going out for a drink and having a good time.
Absolutely. I think, alcohol consumption amongst young people, and when I say young, we're talking about 11 to 15-year-olds, 20% of whom drink at least once a week, drinking quite large sums of alcohol. The average consumption is over a bottle of wine a week amongst 11 to 15-year-olds, and that's too much for the developing liver to really handle safely. So we need to look at the normalisation of drinking, and we also need to look at price. We have to accept that with alcohol available so cheaply, young people can afford to buy a binge drink just with their pocket money, and that's got to be linked with increased consumption as well.
OK, Imogen Shillitoe from the British Liver Trust, thank you very much indeed. Thank you.